A new study released just yesterday has found some shocking statistics about the current state of mental health among LGBTQI plus youths here in Ireland.
Here to break down just some of the findings is the professor behind the study, Agnes Higgins, along with Moninia Griffith from the LGBTQI plus youth organisation Belong To. You're very welcome this morning, ladies.
Thank
Agnes,
you.
To begin with, can you talk us through the methodology behind this report?
Before I start, I just want to say a very big thank you to the 2,800 people who participated in the study, who filled it out and trusted us, I suppose, with their lived experience in terms of what they wrote on the study. The study is kind of a follow-on from a 2016 study that we did on LGBTQI mental health, and the current one was a study that we collected in Module 1 from LGBTQ people in terms of an online survey, which asked quite a range of questions around mental health and well-being, around school experiences, around healthcare experiences, around safety, online media. So we had quite an array of questions in it. And then on Module 2, we also had a public attitude survey.
Okay, what have been the key findings?
I suppose in terms of the key findings, if we look at the age group, we had people from 14 right to the age of 84 within it. So for people over 25, you can say, that their mental health and well-being they're thriving and doing well. It's for the under 25 age group, and particularly the 14 to 18 age group, in terms of seeing much high rates of mental and psychological distress in relation to depression and anxiety, stress, self-harm, suicidal thoughts, suicide attempts. And I suppose the other piece is their experience in terms of school. While it's challenging for all young people, it's particularly challenging for adolescents and young people that are identifying as LGBTQI. We had 50% of people saying that they had experienced bullying and harassment in school, and that was much higher for people who identified as transgender and gender non-conforming. And of course, that group also had high rates of mental distress when we compared it to kind of the cisgender peers within the study.
Okay.
And I suppose bullying and harassment had a huge impact in terms of people's willingness and desire to leave school. 1 in 3 people were saying to us that they thought about leaving school, and a percentage of people had left and skipped or missed aspects of school because of it.
Yeah, Moninia, you're working with LGBTQI plus group. You're working with the community with Belong To. Are these results surprising?
Well, very, very disheartening and upsetting, but not altogether surprising. We are working with young people aged 14 to 23 in Dublin, and we support a network of youth groups across the country that work with the same cohort of young people in all corners of the country and in schools all across Ireland as well. So these are the stories that we're hearing. So this is really our evidence base to talk to policymakers, to talk to those who have the power to make the change, that this is what's happening. Our young people are really, really struggling. We know COVID has had a negative impact on all young people's mental health. But when you compare young LGBT people with the general population, they're 3 times more likely to experience anxiety, stress, self-harm, and 5 times more likely to attempt suicide. And what I found really shocking in the report was 15 was the most common age for a young LGBT person's first attempt on suicide. And for anyone who has a 15-year-old in their life, they're just babies, really, trying to grow into adulthood. So very upsetting, a real wake-up call, I suppose, for us. It's not the Ireland that we voted for back in 2015.
That's what jumped out at me when I saw these stats. Here we were being celebrated around the world because of that referendum. But instead it's become worse.
And I think that's what has happened. So we've seen a lot of young people coming out younger. So the average age for young people coming out now is 14, which is 2 years earlier than in 2016, which is a good story. It's a positive news story. Young people are saying that they are feeling much more welcomed by their families, by their friendship groups. But the story we told them in 2015 is it's safe to come out. We love you, we accept you, but that's not their lived reality. They're experiencing a huge amount of hate online. They're experiencing bullying in their schools. They're experiencing violence on the streets. And it's just all being internalised. They're feeling huge levels of anxiety. And in some cases, unfortunately, it's leading to self-harm and suicide.
It is scary.
It is
Massively
scary. Absolutely. It's heartbreaking. And Agnes, you mentioned that this was building on a report that was first made in 2016. When you compare the two, is there any big jumps or anything? Like, how do they compare?
I think when we compared in terms of the general population of both and controlled, I suppose, for the differences in the demographics and the numbers and age and that, what we did see was that we had a jump in the rates of people who were reporting symptoms of severe and extremely severe depression, anxiety and stress. Now, we didn't see any changes in the rates of self-harm, suicide, but thankfully, in the sense, what we would have liked to have seen was things gone down, but thankfully those haven't got any worse. But they are bad for the younger population as it is.
Okay. Between 15 and 18, it's alarming, these figures. From 18 to 25.
We still see high rates. We might see them starting to come down a piece, but it's still a kind of a very vulnerable time for LGBTQI people, and especially for people who are trans and gender non-conforming.
Yes.
And I think that's the piece, even in the public attitudes survey, where we saw a positive shift towards people who are lesbian, gay and bisexual. You know, there was a less positiveness towards people in terms of who the questions we asked around transgender and intersex, and even wanting people agreeing to include issues around transgender and intersex within curriculum, bathroom use, engagement in sport. Now, what was very clear in that when we looked, those people who had higher knowledge on and self-reported higher knowledge on transgender and intersex community, or who knew people and had kind of a level of proximity, had much more positive attitudes. Okay. So that gives us a pretty good direction in terms of where we need to go here in terms of education and engagement.
Yes,
again, it's education.
Yeah. It's education. I mean, and as good citizens, as good people in families and communities and workplaces, it's up to us as individuals to educate ourselves. It's not up to trans and intersex people to educate us.
It's not just up to teachers.
No, it's up to us as parents, as uncles and aunties, to educate ourselves. The thing I would say is a lot of younger people know much more about gender identity than, my age group and older. So it's up to us as individuals to educate ourselves and to address homophobic and transphobic language and bullying when we see it, and to have the courage and the conviction to stand up against it.
Yeah, I think so, because there's a lot of that kind of that rhetoric online at the moment, which is kind of what we heard about gay and lesbian people maybe 20, 25 years ago. Yeah. Hopefully that is improving, but there are some positives in this. Yeah. Findings. Tell us about them, Agnes.
I think that, there's a lot to be celebrated as well, in terms of the positives, in terms of the support people reported receiving from their peers network within the LGBT community, from families, and I suppose from the LGBT community organisations, that came very how important those spaces were, and how important those spaces were in terms of even finding your tribe online. But the risk is going online is that then, as a young person, you're also exposed to this very negative anti-LGBT speech that people also reported experiencing, which, has such an impact on a 14, 15-year-old.
It's such a vulnerable age.
And I think the other positive impact, we have to say, the people did say, in terms of, and the right across from the total sample of people that were involved, the positive impact that the kind of legislative changes and the positive impact of policy changes. And I suppose the positive impact of seeing LGBTQI people, right across the spectrum being represented in the media, and so I can have some sense of identification you know, and that's the importance, I suppose, of having these positive media pieces. So if I'm looking at a 14-year-old or a 15-year-old and I'm seeing somebody that represents me and my voice in a positive way.
Yes, because if they can internalise the negative stuff, they also internalise the positive stuff, which is why representation is so important. Ladies, thank you so much for coming in and chatting to us about that.
Thank you
very much. If you have been affected by any of the issues discussed today, you can find contact helplines at virginmediatelevision.ie/helplines.
There's lots more to come on Ireland AM. We'll take a quick break. We'll be back with you in just a few minutes.